Thank you so much, Mike. Always bold and direct to the point. That is what we need in this discussion and in this panel, because we are in front of a big challenge, but at the same time we are also looking for the future, and we would like to have a future where everybody is safer, and that's one of the goals of the emergency program of WHO. I have now the privilege to ask Amadou to please come and give his introductory remarks. Amadou, thank you.
Yes, thank you very much, Tyro, and very grateful to the presentation, to the organizer for inviting us for these important meetings, and I really see that as a privilege. As Mike was saying, I mean, this has been a huge learning opportunities for all of us. And particularly, I want to bring the perspective of what we lived here from Africa that is really important at the global level. And I have 4 main intervention points that I want to bring very quickly. So number one is really the importance of surveillance, because the capacity to detection quickly, sharing the information has been absolutely critical from what we learned. We've been lucky in Africa to get the information way before, so we can get people trained and start actually having countries ready to be able to detect these epidemics. And this helped us really to be ready very quickly. So the fact that we can do surveillance at the genomic surveillance level, we can be able actually to do at one house level, is a lesson that we need really to clearly master on this, and particularly in the area of actually sharing that data and sharing that information. That has been extremely helpful. The number 2 questions, the number 2 topics I really want to touch in terms of lesson is dealing with scarcity when it comes to medical and non-medical countermeasure. Vaccine, diagnostic, therapeutic oxygen has been really something we've been chasing since the beginning, a different rhythm. But obviously, the main lesson we should take on that is building local capacity to do that. Today, there is a huge enthusiasm to making vaccine manufacturing a reality in Africa. I think this is something that we need to push. At the same time, at the beginning, we had to come with solution to make available diagnostic tests at very affordable price. So making sure we have local capacity to be able to do manufacturing of those measures is a lesson that we need to master, and we need to really apply for the future. The number 3 things is the importance of coordination. And when I say the coordination at the global level, and in this regard, WHO has done tremendous work, and we need a very strong WHO in this regards. And I'm so happy that we've been interacting with Mike and all other people. This has been critically important, but also at the regional level. Africa CDC, WHO, Afro, West African Health Organization has been placed where this coordination and the governance at the global level have been key to pass messages and make sure we're doing it at the national level in the right way, so we can be all very strong in what we do. And the last part I just wanted to mention is the real need to be able to understand when we have this very complicated measure to implement, how we can engage community properly and make sure while we do that, we are bringing them into that system. This has been a very important lesson because dealing with COVID has been really handling the behavior of the people in terms of lockdown, in terms of asking them to have masks. And I think this is something that was critically important. And from all that, I think we should learn and we should make sure that this crisis has not been spoiled in this regards. And I'll stop there and take any questions and would be happy to participate to the different discussions. Over to you, Sarah.